When we talk about breast cancer, the normal assumption is that we are talking about women getting the disease. After all, breast cancer is the commonest cancer that affects women, with a 1 in 7 risk of developing it in their lifetime. However, men can get breast cancer too, and it's something we don't really talk about very much. Unlike breast cancer in women, the incidence of male breast cancer is low, and so it's not a disease that is thought to affect men. Yet, men can get breast cancer, and I think it's important to increase awareness. So how common is male breast cancer? Well, it represents less than 1% of all cancers in men and less than 1% of breast cancers. In the UK, we see about 390 new cases per year with a life risk of 1 in 870. So compare this to 55,000 new cases of female breast cancer per year in the UK. So the risk is comparatively low. So what are the risk factors? Number 1, increasing age. Like most cancers, the risk of breast cancer in men increases with age. The incidence steadily increases, peaking at 72 years with an average age of 67 years. Compare that to 62 years for women. So age is a risk factor, and we know that men with breast cancer do present at an older age. Number 2, ethnicity. The risk of breast cancer in black men is greater than white men. Black men also have a poorer prognostic feature, such as larger tumours, axillary lymph node positivity, and higher grade tumours compared to that of white men. Number 3 is family history. And there is a stronger correlation for men who report a sister alone compared to a mother alone with breast cancer. The risk of breast cancer, though, increases tenfold if both mother and a sister have breast cancer. Number 4 is gene mutation. If you're a man and you have the BRCA2 gene mutation, then you have an increased risk of breast cancer with a lifetime of 5 to 10%, compared to that to the general population risk of 0.1%. The American Society of Clinical Oncology has recommended genetic counseling and testing to all men with breast cancer. The association of male breast cancer with the BRCA1 gene mutation is less strong, with a risk of 1%. Number 5 is radiation. The most robust evidence that has shown how increased radiation exposure increases male breast cancer risk is from a study looking at survivors of the Japanese atomic bomb. Chest wall irradiation, such as those for lymphoma, may also increase the risk of male breast cancer. Number 6 is Klinefelter syndrome. Increased estrogen or low testosterone levels have been implicated in increased male breast cancer risk. Klinefelter syndrome is a genetic disorder where males are born with an extra X chromosome. Hence, it's also known as the XXY syndrome, and it occurs in about 1 in 1,000 live births. Affected men typically have underdeveloped testes that do not produce as much testosterone as usual, and there is an increased risk of breast cancer in men with this syndrome. Number 7 is liver disease and obesity. Data from case control studies suggest that increased estradiol levels are associated with male breast cancer, such as in liver cirrhosis and exogenous estrogen use. Men with a high BMI or body mass index of over 30 have an 80% increased risk compared to those with a BMI of less than 25. So how does male breast cancer present? Well, it normally presents with a lump, usually behind the nipple area, although it can occur almost anywhere in the breast. It can also present with nipple retraction, skin changes, and nipple discharge. And so the symptoms are similar to that in women. Now, men can also have a condition called gynecomastia, which is a benign condition that usually presents as a lump behind the nipple area. Clinical examination and imaging should be able to differentiate between these two conditions. However, if the appearance is suspicious, then a biopsy will be performed to confirm the exact nature of that lump. So, how is it investigated? Like for any breast lump, you will need to see a breast specialist. The lump will be examined and then it will be scanned with an ultrasound scan, and in some places you may also get a mammogram. Non-cancerous or benign lumps will have characteristic features, both when it's examined and also on the scans, and if it looks benign, then no further investigations will be needed. But if it is suspicious, then a biopsy will be performed. So how do you treat male breast cancer? Actually, you treat it in a similar fashion to female breast cancers. Depending on the individual, this may involve surgery, chemotherapy, radiotherapy, and endocrine treatment or tablets. And I will go through this in another video. So, see you in the next one.